Hi everybody, I wanted to present to you my presentation on anodyne light therapy or infrared light therapy. What is anodyne therapy, first of all? First, it is a system that delivers monochromatic light to the tissue, and it helps promote circulation, reduces pain, can help improve ulcers or wounds by improving the circulation to the affected areas. The most popular conditions that this is used is diabetic neuropathy. 70% of the cases that use this type of therapy is from diabetic neuropathy. And it's helped to increase that circulation because typically folks that have this have decreased sensation in their peripheries, like their fingertips or their toes. So this is to help increase that circulation, to improve sensation, and to overall help their overall function in life. There are other conditions, tendinitis, bursitis, pre- and post-surgical swelling conditions, but the neuropathies are the most popular. So how does this exactly work? The monochromatic infrared light energy, which is also abbreviated the MIRE, and again, Anodyne is the brand name. This would usually go by infrared light therapy or the MIRE. And what it does is it combines the topical heat that helps promote the blood flow to the tissues that ultimately releases nitric oxide. And the nitric oxide helps increase the circulation and reduces inflammation in the tissue. So the equipment, and there's two typical pieces of equipment. There are the clinic system, which is much larger. It's a bigger box, and it has 8 electrode pads, and these are the pads here. You can see it has all the little diodes on here, and they're all little light bulbs. I'm going to turn it this way if you can see it. There are just little light bulbs, and even when they're on, they don't light up like a typical light bulb. It's an infrared light, kind of like the light on your remote control. You can't really see the beam that's happening, but that's what's happening here. The clinic system is very expensive. It's $6,295. The home units, which I have with me, is $2,995. And the home units have 4 of these pads and then just a small box, as you can see here. It's pre-calibrated, so all they have to do is hit the on switch, which is on the back. Treatment guidelines: typically a person wants to wear these pads at least 3 times a week for 4 weeks. And then halfway through, they will be checking to see if there's any increased sensation, reduction in pain. Indications, like I've said previously, the folks are typically with those that have decreased circulation, increased pain. It also helps reduce muscle stiffness and muscle spasms. Some major things to avoid are these pads cannot be placed over active cancers, tumors, active wounds, over the womb during pregnancy. They should also not be used over any topical heating agents or cooling agents like Bengay or Icy Hot. So that's also important as we're putting these on, which I'll show you in a minute, that all the skin needs to be clear of any lotion, creams, or oils. Some other safety precautions: even though this is a very low dose heat, it can cause burns in some people who have especially thin skin. So it's very important that the initial time frame while we're getting this first started, that you need to be completing skin checks with your patient at least 10 minutes into the treatment, and then every 10 minutes after that, and that the pad should not be on for more than 45 minutes for one treatment session. Like I said too, cannot place these over any topical heating agents and over any thin skin or necrotic or dead tissue. That's also very important. The other safety precaution with this too, especially if we're treating diabetic patients, is there has been studies that shown that this can affect their blood glucose levels. So in our first couple weeks of treatment, it is important that the patient is monitoring their blood glucose levels following treatment, and making sure those are staying within their customary limits per their doctor's requirements. So how do we get these little suckers on here? And you can see it's just a little pad. Because of barriers and we want things to stay nice and clean, a thin sheet of plastic, which is just a piece of saran wrap, is going to cover the affected area. And you want it to be something clear, so it's not going to, the light can penetrate to the tissue. So you can see I have my hand covered in the plastic. The pads, you want to cover as much of the area as possible. Excuse me, and reach for my other pad here. So typically, whether it's the hand or the foot, you will want this placed in more of a T-shaped pattern. So you can see here, I have it in a T-shaped pattern. And it's also a safety precaution that this is not applied to the tops of the hands, tops of the feet. So this would stay on for about 40-45 minutes. What a normal physiological change that a person could feel is warmth to the tissue, especially with the wrap on. It might get kind of sweaty feeling. It'll feel a little warm. When the pads come off, the person will feel, they will also see some redness at the skin, and it's just more of a pink redness because of that increased circulation to the top of the tissue. If the person has very dry skin, they may begin to get some flaking or some peeling of the skin, which is normal just because of that increased fluid and the increased circulation coming to the top of the tissue. As long-term follow-up with this type of equipment is the studies are still out on this one. A lot of studies are showing that 90 days post-treatment, there's not much long-term effect with the treatments. So someone who is chronic diabetic and has chronic neuropathy in the ends of their fingers or in their feet, the person may need to be getting a home unit to do this long term. So the downfall with that is that it's very expensive. A lot of insurance companies are not covering these units anymore, so it is very expensive. Like I said, it's almost $3,000 for the home unit, and most insurance companies are not covering this anymore. So how is occupational therapy involved with this? Well, obviously, if we're treating the hand, and if they're not having good sensation in their hands, they may be dropping a lot of things. Their fine motor coordination may be affected, which can lead to troubles with buttoning buttons, managing money, everyday ADLs. So we want to try to increase that circulation and decrease their pain so they can have the highest potential functioning in their home and in their daily lives. So just to review some different strengths and limitations with this type of thing, it is drug-free. So a lot of folks who are on many drugs, this is nice for them. It is non-invasive, it's portable, it is FDA approved. There are no known drug interactions with this so far, and it can be placed over metal implants or imports, and it can improve the patient's tolerance to complete the therapy or get involved with everyday ADLs. Some limitations that it does take the long-term follow-up. It is very expensive. It can cause skin irritation. There is a potential for burns, and it can also increase their pain temporarily because the circulation is increasing. So a lot of clients will complain that they're having actually more pain than they started because that circulation is returning to the skin surface. So there are some counter indications and some limitations to this as well. But it's a nice trial. It's supposed to be used as an adjunct to any other therapies, neuromuscular re-education, functional ADL training, task orientation training, and that type of thing. So that is my presentation on Anodyne light therapy. I hope you all enjoyed it and have a nice day. Thank you.